Okay, so thanks very much. It's a great privilege for me to be able to come and speak with you today. I'm here to share a little bit about my experience in managing a supervised injection facility, or a SIF, as I think I'm probably the only person in this room who's had that particular job description. The first SIF in North America opened in Canada in 2003, and at the time I was hired as the coordinator responsible for the rollout of the day-to-day activities of the site. I did that until 2008 when I was promoted to the position of manager of HIV/AIDS and harm reduction services for the regional health department, under which designation I continued to oversee the SIF and other related services. I moved to New York in 2011. So I'm not really here representing Open Society, I'm just talking about my previous experience in Canada. How does this? Oh, go back. Oh, go forward. Go back. All right, so this picture is from the early 1990s. At the time, activists had planted 1,000 crosses in a local park to represent lives lost to overdose and HIV in our city. That was about 10 years before the SIF opened. Yes.
Back of the room can't hear you.
How?
You might have to.
I'll speak up. That was about 10 years before the SIF opened, when illicit drug use had become a leading cause of death amongst men and women between the ages of 30 and 44. A task force, much like this one, was set up, but change was slow. In this picture, you can see death confronting, or, oh, I'm having trouble with this, sorry guys. You can see death confronting our mayor. In 1998, almost 200 people had died of an overdose just in one area of our city, and so the chief medical officer declared a public health emergency. I'm sorry, guys. Excuse me for my, okay, here we go. So our injection site opened in 2003. It's not the first of its kind. There are many in countries around the world. Approximately 100 are in operation today in Australia, Europe, and Canada, and have been since the 1980s. Our SIF opened as a scientific pilot research project. It has 12 booths and is open 18 hours a day. I'm not saying that that is the best or only model. I'm just explaining what we were able to do at that time in Canada. It's a simple service. It offers people sterile injection equipment like a needle exchange program, and also a space inside where they can use that equipment to inject illicit substances. It does not provide drugs of any kind. People are not allowed to buy or sell or share drugs on the premises, and access to the site is anonymous. People use in private booths. I'm just showing you a few pictures here. And staff members are available to assist with injection-related education as well as to intervene in overdoses. After you've finished using the site, the injection room, you can move to a second room where you can have a cup of coffee and also talk to somebody, just pass the time of day, and that is where you can talk to somebody about getting into detox or treatment or getting housing or getting help of any kind. It starts from a place really of accepting that people are using drugs and welcoming them into the premises without judgment, and in turn this opens up a whole new realm for the therapeutic relationship. The Government of Canada spent $3 million, which is a lot of money even in Canadian dollars, evaluating the site. The evaluation was carried out by the BC Centre for Excellence in HIV/AIDS, which is an independent body, a team of well-known researchers. They had a control group, so they were able to compare people who chose to use the site versus people who didn't use the site and the outcomes among them. And they published all their data in like high-ranking medical journals like The Lancet and the New England Journal of Medicine, so it's all been subject to peer review. I'm not going to go over all the data because there isn't enough time, but the evidence is compelling. And I think I shared a handout that contains links to all of the papers. Some of the information that I think will be interesting to you is that this SIF was able to attract a wide cross-section of drug users and also retain people who are in a really high-risk group, so people who are HIV positive, injecting in public, women who are at higher risk of violence. The site was found to not make things worse in the community, but actually to improve public order. So it reduced public injection, it reduced littering of drug-related paraphernalia, it did not increase petty crime or loitering, it did not increase rates of drug use overall in the community. So that is really important for you all to know, because the presence of this SIF over time was shown to not lead to an increased risk that local people who had quit using drugs would relapse into drugs. Nor did it lead people to avoid accessing drug treatment, nor did it encourage first-time injectors to start using drugs. None of those things bore true, and as a result of that, after it had been open for a few years, the local community and business associations gave this SIF a 75% approval rating. The longer it is open, the more people approve of it. It also was shown not to have a negative impact on crime, which is important to know. It did not increase drug trafficking in the neighborhood. It did not increase vehicle break-ins, assault, robbery, or any of those indicators. And so our Royal Canadian Mounted Police, which is the Mounties, you know, the guys in the red coats, concluded that supervised injection sites do not increase crime. What they do very well is prevent overdose deaths. So there have been about 3.5 million injections there since it opened and counting. I don't know what the number is today, probably about 4 million, and a lot of overdose events and not one overdose fatality. And this is really important because it's significant enough to have a population level impact in terms of a 35% overdose mortality decrease in the neighborhood and up to 50% in certain populations. Contrary to common misconceptions about a SIF, it does not promote drug use. In fact, studies really show that the reverse is true, and it acts as an on-ramp for people to access detox and treatment services. There's a bunch of different studies that were done, but one piece of data that I'll give you here is that in the year after the SIF opened, there was a 30% uptake into detox and treatment services in the surrounding city. As a result of all this, it saves healthcare dollars. There's a bunch of different models that were used to determine how many dollars. This is one estimate, which is a lot of money, even in Canadian standards. And this is from reducing the spread of HIV and Hep C, preventing overdose deaths, and reducing pressure on hospital emergency wards. This is our detox and our women's treatment program. So by 2006, the SIF had created such a pressure on the detox system that we actually opened a detox facility right upstairs in the same building and a women's treatment facility down the street. And I think that's important to know because the point is that supervised injection is really best conceived of as part of a continuum of care. So we were able to meet people wherever they were at in the cycle of relapse and recovery and help people stay alive long enough to start cycling out of that cycle. Last slide. Justin Trudeau had nothing to do with the SIF, but that picture is there because this issue of Maclean's is the one where it was announced that in the neighborhood where the SIF is located, in the time since it had been open, there was a 10-year increase in life expectancy. So people were living on average 10 years longer, and this was one of the reasons. So by now, the SIF is just basically seen as an essential part of dealing with drug use in the city, and is supported and defended even in the mainstream, which might seem crazy, but that is totally the truth and the experience of our city. And this is my contact information. I would be really happy to answer any questions now, or if you want to follow up with me.
So all Sarah's information is